Dr. Muscolino again, and what we want to do now in this portion is to highlight some of the things we found on examination. The steps with a new patient are consultation, examination, a report of findings to the patient, and then, of course, treatment. One of the famous diagnosticians from Mayo Clinic said that 90% of what he finds is found in the initial consultation, and I believe that to be so. That's why we don't rush the consultation. We let the patient speak. We ask leading questions to find out what's going on, and then we follow it up with a thorough examination, including orthopedic, neurological examination, kinesiological examination, and in some cases blood tests, hair analysis, and sputum analysis. Okay, before continuing the spinal adjustment, I want to show you the relationship, as we spoke about before, between the psyche and the structure. Now I want to show you what's often referred to as psychosomatic approach, meaning the way she thinks can influence her muscles. And vice versa, by helping the structural system, we could to some degree help the psychological system. So stress isn't just psychological, it's psychological, structural, and biochemical. What I'd like you to do is think about anything that might be worrying you. But before you do so, I'm going to retest this. Hold it. And it's strong. Now just think about what might be bothering you. You don't have to talk about it. I'm not a psychologist. Okay? Think about it. And now that you're thinking about it, I'm testing the same muscle and using the same or less force, only 2 fingers, and you can see how weak this patient goes. And it's because the structure is being influenced by the way she thinks. How many times have you had a happy experience and all of a sudden your well-being is elevated? Well, it could happen the other way too. You have a negative experience, and as a result, musculature suffers. Now, the method we use, one of the methods as a stress buster, and this is one I showed at a FEMA meeting not too long ago when we were talking about stress reduction, is the patient touches these points. So if you could do that, and what she's doing is touching certain points we call neurovascular points. The neurovascular points affect the brain area and the area of the brain that affects emotion. At one point, the cardiac system was such that the heart would pump, and it would pump at different stations. And as we grew older, of course, that changed. So in embryonic life, the stations, one of which was the cerebral area. So touching those areas helps that particular area. Now we're going to test whether or not it worked. So relax again, and now think about whatever you thought about before. And I'm going to retest. Hold it. And strong. So just using that simple approach can help reduce tension. And the approach we used to balance it was called a somato-body psychic approach rather than psychosomatic approach. So again, now we're hitting upon the psychological approach to well-being and to stress reduction. This is only one of the many things we do to reduce stress. We also try to reduce stress nutritionally as well as mechanically through the spinal adjustments, since nerves from the upper neck affect the brain and the nervous system. For further information, please call me at 914-725-4844 to find out more about the integrated approach using structural, biochemical, psychological integration. Or if you want to find out more about how the nervous system, using Oscar here, can affect your body through spinal nerves going to all parts of the body, again, please call me either for further information or to set up an appointment for consultation. Thank you for watching this video, and again, call 914-725-4844. I could be reached at that number for both my offices, either at 1024 Wilmot Road, Scarsdale, my main office, or 166 East 88th Street in the city.